Ma'am, I have started the broadcast.
Okay, thank you. A good teacher can inspire hope, ignite the imagination, and instill a love of learning. Good evening, one and all. Wish you all a happy Independence Day. At the very outset, let me thank Dr. Sanjay Bedi sir for creating this platform to get associated with the learned and enthusiastic anatomists from all four corners of our country. Today's topic for discussion is how to choose a teaching learning method, that is, deriving teaching learning methods from competencies. The objectives of my today's session is they are at the end of the session, the participants should be able to name the types of classification and list the different teaching learning methods, identify the factors influencing learning and selection of teaching learning methods, discuss the relevant extract from GMER 2019 pertaining to teaching learning methods, and also to enumerate the steps involved in deriving teaching learning methods from competencies and discuss its principles with examples. Before we go into that, I will just give you a definition for learning. So it is defined as, this is one among the many definitions which are there. It is defined as learning as a transformative process of taking in information, and that when internalized and mixed with what we have experienced, changes what we know and build on what we do. So it is based on the input, the process, and the reflection that will cause a change in us. That means a person after learning will be able to do something which he was unable to do earlier. Now, this is a Chinese proverb, a thousand teachers, a thousand methods, even though I'm reluctant to use anything Chinese nowadays. This quote carries the essence of today's session because this itself shows the umpteen or countless number of teaching learning methods available and the reason behind providing you the reading material before my today's session was just to clarify or to make it clear the what are these teaching learning methods. And all these teaching learning methods, they have been classified in different ways. The array of classification are, it can be either teacher oriented or non-teacher oriented. Self-directed learning, I have kept it separately because there is another topic on that separately. Well, then you can classify all these methods depending on the number of learners, that is large group, small group, and individual, depending upon the domains of learning, knowledge, skill, attitude, and communication. So depending on this, these vast types of, there are so many methods of teaching learning methods we can classify here. For us, I would say that this is most important, that is the classification under the domain based teaching learning methods, even though we have to consider the other way of or the other classifications too. So under the domain based learning, the cognitive domain, you can use lecture, panel discussion, symposium, project work. I have put it here because when we give a project work of a model making, I have mentioned here because we are not looking into how the skill on model making, but if we are giving a model making something like a larynx model, we are asking the student to make a model. He might or she might make the model perfectly only if he or she knows the anatomy of larynx. Then psychomotor domain are the skills domain, where demonstration, simulation, bedside clinics, workshops, practical skills lab or dissection classes can be used for teaching. Affective domain, You can use role play, demonstration, video shows, movies, even bedside clinics, workshop, and theater forum. So these are some of the methods for teaching something in the affective domain. Now, when it comes to the control base, that is teacher controlled and learner controlled. So we know that lecture, symposium, control group discussions, all these are teacher controlled, whereas learner controlled, we have free group discussions, project work, assignments, self-study, as well as computer assisted learning. There are many more. When we consider group size, that is how many groups, it is a single group or small groups, there are large group, there are small group, as well as there are individual methods of learning. As well as there are newer trends in learning. The newer trends are the problem-based or the case-based learning, the flipped classroom, mind mapping, integrated teaching, e-learning, online learning methods, theater of oppressed, portfolios and feedback. At this juncture, I would just like to say a few sentences about theater of oppressed because I feel that some of, for at least for some of you, it might be new. This is something created by a Brazilian theater visionary, Augusto Boal. That is, he made a forum, a theater forum, that is for a popular community-based education that is using a theater as a tool for a social change. So this is can be used to enhance the learning in effective domain. And what Augusto Boal said is that the purpose of theater of oppressed is to rehumanize humanity. That is what he said. I know, of course, I have put portfolios there. Portfolio is an assessment method. What I believe is that, but when the learner is writing the portfolio, reflecting on what he has done, that itself is enhancing his learning process. And of course, feedbacks also enhance the learning process of a learner. So all these are the newer trends of learning methods, which we are using. Nowadays, we can. Now, there comes the dilemma. So many methods, the thousands of methods. So which one is the single best method? Now, that is the biggest dilemma for every educator. And the answer is simple. There is no single ideal method for education because an effective teacher combines various methods to achieve the educational objectives in an optimum way. So that is the skill of the teacher. That is, we have to decide which method and how to choose. So coming to the selection of teaching learning methods. Well, let's see what are the factors or criteria which can be considered while choosing the teaching learning methods. First of all, we have to consider the objectives, domains of the objectives, and the content. Of course, we have to consider the capacity, intellectual maturity, receptiveness, level, and nature of learning of the student. Of course, class strength and available resources at our end are very, very important. Teacher's personality and asset. This means that how far the teacher is capable or trained or he or she has an authority to choose that teaching learning method. And of course, last but not the least, feedback. This is very important. Suppose you have chosen one method to teach some objectives and you find that it is not it is not feasible for you to attain that objective with this method, or you're getting a feedback that it is not good enough, then you can when you get the feedback, you can improvise or you can change the method, and that helps you to choose some other method to obtain your objective. So that, of course, feedback is very, very important in selection of teaching learning methods. Now, having said all these things, now let us consider our CBME curriculum. When it goes to the CBME curriculum, we all know that CBME curriculum, that is an outcome-based curriculum where the driving force is the student, and both teachers and students are accountable for the content. That is, this shift has now become, or it has challenged the medical educators to look in a different way of teaching. So this is about CBME, that is called as the SPICES model. From teacher centered, it has gone to student centered. From information oriented, it has gone to problem based. And as I highlight all these differences between the traditional and CBME curriculum, I would also like to share some or emphasize on some important points or the changes in the learning process. That is, in CBME curriculum, it is a shared responsibility of the learning process. Both teacher and students share the responsibility. There are newer methods of the self-directed learning and collaborative learning. Then it is a learner-centric approach, and formative assessment and being a very integral part of CBME curriculum. We should always keep in mind how you are going to assess the student for this skill or knowledge. Keeping that in mind also, you have to frame your teaching learning method. Let us consider certain relevant extract from GMER 2019 regarding teaching learning methods. So it is, yeah, I have already mentioned that teaching learning methods shall be student centric. And of the total hours which is allotted to any subject, it is said that 1/3 will be didactic lectures, 2/3 of the total teaching learning hours or time should be allotted for small group discussions, practicals, interactive sessions, case-based learning, collaborative and team-based learning, and guided STL. So what I have put in the brackets are the hours allotted for anatomy. Out of 675 hours, the didactic lectures are only 220. The small group discussions, practicals, interactive sessions, case-based learning, collaborative, team-based, all these should can go up to 415 hours, and guided SDL is 40 hours. Along with that, we have got another 30 hours for our early clinical exposure. So totally coming up to 705 hours. So now, this is something I would like to talk on. That is, this is something called as the gradual release of responsibility model, which was developed by Fisher and Frey. This teaching methodology contains 4 stages of learning, which are conducted through a simultaneous top to down or bottom to up learning approaches. So here you can see at the top, the teacher's responsibility is more. I do it. As you come to the bottom, you can see the student's responsibility is increasing. And you can see that collaborative word which I have, which is highlighted there. And this is what is actually we intend in CBME curriculum. That is the collaborative learning where both teacher as well as the students come together and you do it together. So from this 2 triangles, I am taking you now to one more triangle, which you call it the golden triangle of CBME curriculum. What is that? Now, this is the triangle that depicts the association between the learning objectives, which are derived from the competencies, and the teaching learning methods and assessments, which together shapes the learning experience. So the learning objectives are the foundation for instructional alignment, and the instructional alignment means learning objectives, assessment tools, and teaching learning methods mutually support each other. That is, the support comes from, and what we intend is the educational outcome. So this is called as the golden triangle. So you derive the objectives from the competencies which was dealt in the previous session. From the objectives, you are deriving the teaching learning methods, and these two are driving the assessment methods. So all these three go hand in hand. I would request everybody to be familiar with this competency table, which shows the number, the competencies, the domain, the level of proficiency, core, suggested teaching method, which is there in the booklet. So which are the domains of learning? MCI has listed 4 domains, that is the knowledge, skill, attitude, and communication. And we need to understand that when you take one competency, it is a combination or an amalgamation of different objectives that is forming a competency, but these objectives can be from different domains. So a competency is an amalgamation of different objectives from different, derived from different domains. And when you consider these domains again in the Bloom's taxonomy, you have got higher levels of the cognitive domain, the affective domain, the psychomotor domain, and that is what we consider in the next one, that is the levels of proficiency. If you see, it is shown as K is knows, that is the knowledge, that is enumerate or describe. Knows how means it is a higher level of the cognitive domain. You are going, you are discussing something, you are analyzing something, that is known as knows how. S is shows, it is just identify or demonstrate something, that is a skill attribute, and it is just the showing part. Then comes the shows how. Now, shows how is something which is a little bit more higher, a skill which is you are interpreting or demonstrating a complex procedure is shows how. And performs is which we expect at the end of the course. So actually speaking, when you take the CBME curriculum from phase 1 towards the end of the course, that is towards the final phase, what is expected is that there is a gradual transition from the knows how level in the early phases to a shift to shows how level, which is expected from the uh, student. So what is that demanding is that the knows how or shows how level, there should be a gradual change from the traditional didactic classroom to a teaching learning environment. Again, I'm taking you to one more triangle, or it is called as a cone. So before we derive or we begin with the steps of deriving the teaching learning methods, you can keep this also in mind. This is called as the code of learning, which was formed by an American educator, Edgar Dale. He developed the cone of experience, also known as the learning pyramid. This is showing how much a student or a learner will retain after 2 weeks. So we can see here in the top part of the cone, you can see it is the passive methods of learning, the reading, hearing words, looking at a picture, watching a movie. And as you go down, you can see it is participating in a discussion, giving a talk, and doing at the bottommost is doing something real. And on the left hand side, you can see how much percentage of those learning which has happened is retained after 2 weeks. So this itself shows that if you do something, that is what you say and do together, 90% of it is retained. So if you want to involve your learner into the learning process, that will help him, her, or him to retain what he has learned better. Okay, having said all this, now we will go into the core topic of today. That is how we are going to derive the learning methods. First thing, the list of competencies from each topic. You know, it is given in our whatever the volume 1, it has been given, and we know that we have got a set of competencies for anatomy. Second step is deriving learning objectives to achieve those competencies. And that was dealt in the previous session. Now we know that how we have to derive learning objectives from competencies. Next step is to now separate out the domains to a feasible extent. To a feasible extent, you have to determine now each of your objective, it belongs to which domain. After that, you can also decide on the level of proficiency also, whether it is know, knows how, shows how, like that. After that, now you have got a set of competencies on which you have decided on the domains and the level of proficiency. Now, out of these so many objectives you have got, you have to group these objectives so that all these objectives, okay, I have got 10 objectives. Of that, 5 objectives I am taking, and this is grouped to one session of the learning process, and that is delivered in one session. So you have decided on that. Then you choose the most appropriate method by which you can deliver these competencies or achieve these competencies through that teaching learning method. And after you have planned the most appropriate method, then you draw up a lesson plan for that session and just implement it. So this is the steps, or these are the steps in deriving the learning method. Now I'm going to an example from anatomy. I have again taken the thyroid gland as example, and this is coming under the topic, if I remember correctly, is the deep dissection of the neck. And in that, I have got two competencies pertaining to thyroid. 35.2 is to describe, demonstrate location, parts, borders, surfaces, relations, and blood supply of thyroid gland. And second one, that is a core competency. Then second one is 35.8, which is described, that is describe the anatomically relevant clinical features of thyroid swellings. Now, that is a non-core topic. So that is non-core competency. And now what I have done, I will just show you. I have now derived so many objectives from those competencies. What I have done is that I have made so many competencies, and at this time I would like to make a disclaimer, rather, that is the SLOs which I have projected are a limited number of SLOs just for a descriptive purpose. So don't think that I have completely put all the SLOs pertaining to that competency. But so what I have done is that I have made my SLOs, that is describe the location, coverings, and parts of the thyroid gland. That is again knowledge domain. Level is knows core. Enumerate the relations of thyroid gland. Again the same domain and level. Then draw and label diagrams depicting the relations of thyroid gland. Describe the origin, course, and relations of arteries supplying the thyroid gland. Then, from the second competency, I have taken up the describe the anatomically relevant clinical features of thyroid swellings. I have made one more SLO of discuss the anatomical basis of the site of ligature of the arteries during thyroid surgeries. Now, these two belong to a higher level, that is knows how. You have to apply your knowledge of anatomy into that. Then I have made 3 SLOs pertaining to the demonstration identification, that is in the shows category. That is, the level is showing. The student should show, the demonstrate, identify. So like that, I have made the SLOs from those competencies. Now, how am I going to derive a teaching learning method? So what I have done is that I have now found out that the 1, 2, and 4, they belong to the knowledge domain as well as that is knowledge level is also knows level. So I thought it can be dealt with an interactive lecture, or it can be dealt with an SGD also. So I have written that down. Coming to the third one, it is draw and label a diagram depicting the relations of the thyroid gland. So that what I have decided is that I will give that as a self-study or an assignment, that is an individual method. Then I have brought the two competencies of knows how level. Now, knows how level, I told you that when you go to higher order, the learner involvement should come. So I have decided that I will choose either a small group discussion or a flipped classroom or a case-based learning. Then for the demonstration identification purposes, I have made as dissection or DOAP, that is observing, demonstration, assist, and perform, which is mentioned in our booklet, or you can use videos. So these are the learning methods which I have decided upon for achieving these objectives. Now let us see. So these three, what I'm doing is that I'm going to take the 1, 2, and 4 objectives of this competency, and I'm going to make it as a single session of an interactive lecture class. So that all those competencies will go to a single section, a session of interactive lecture. And this third one, I'm not going to introduce any teacher assisted method. I'm giving this as a self study or an individual method, an assignment I'm giving. Okay, learn this and draw it in your gross anatomy record. That is an assignment which I am giving to the student. These two, now that is the knows how, I am going to combine this, and I'm going to decide that I will do a short group discussion, a case-based learning process. And this two together with all these will become another session of learning. And the last three, I have decided to make it a 1 day session or a 2 hour session of dissection. And that is going to, all these will be the objectives of my dissection session, which I have planned on some day. That is a 2 hours dissection, which I am planning. So this is how now I have made the objectives. I have found out many teaching learning methods by which I can achieve these objectives. And then I am taking out these objectives, clubbing them together, and I am deriving a session, teaching learning session for this. Now, this is the Bloom's taxonomy, the higher orders of the cognitive domain. So when you're choosing teaching learning methods of cognitive domain, now let us see what are the higher order levels in the cognitive domain. That is knowledge, just know specific facts or terms. That is something a recall. Then comprehending, you are comparing or contrasting. So in the knowledge level, okay, you're telling, okay, name the branches of this artery. Okay, fine. Comprehend, you're comparing something. That means you, okay, compare or differentiate between the microscopic structure of a large artery and a medium-sized artery. So there is something little bit more of comprehension. Application, next level. You're applying your knowledge of normal anatomy into a scenario that comes an application, further analysis. I think we stop here with a phase 1 student. Evaluation, synthesis, and all are much higher levels, which we don't expect the student to achieve at this stage of learning. So now, now what we have to understand is that now we have considered the cognitive higher order cognitive domain, or whether it is from the lower level of the cognitive domain. So now when you are choosing a teaching learning method for this, all these are from the cognitive domain. Suppose your competency and SLOs are from cognitive domain. So what I have done, like I have chosen the interactive lecture for the nose level. So which is coming to the lower part of the cognitive domain, nose. It can be accomplished by a traditional didactic form. Whereas when it goes on to a knows how level, it requires more learner involvement, and hence you have to choose a method of lower learner teacher ratio. And there are some more factors to be considered. I will come to that later. So this is how you choose a method when it is going according to the the objective to which domain or to which level of proficiency it belongs. So according to that, you are planning. So you go to higher level of proficiency, you need a lower learner teacher ratio to accomplish your objectives. Now this I have put just for the skills domain part. Here, this is also one competency in our booklet, that is 13.7, where it is given identify and demonstrate surface projection of cephalic and basilic vein, palpation of brachial artery, testing of muscles. All these together is a competency given. Now I have just highlighted in blue, which I'm going to take. I'm taking the surface projection and palpation of brachial artery and radial artery. For that, I have made at the end of the session, the student of phase 1 MBBS shall be able to demonstrate the surface marking of brachial artery on the cadaver. So that the knowledge and skills domain, he has to show how it is. They have to draw and show. They should show, exhibit the skill of showing the marking, the surface marking on the surface of the cadaver. So I can use as a method of teaching I have adopted is the demonstrate, observe, assist, and perform session. If you want, you can choose a video showing how it is done. So that again depends on you have got many methods. This is again belonging to the knowledge and skill. Now I have taken the next one. That is where somewhere at least we can implement the effective and communication domain. This is demonstrate the palpation of a brachial artery on a human volunteer. So there you can show that there should be effective domain, how the student behaves with that human volunteer who is assisting his learning process, and how he should be communicating with that person. So such things can be brought into this if you choose in such that we know that in anatomy, the affective and communication domains are very, very minimal. So this in this we can at least teach them or show them or may assess their learning in the effective and the communication domain where you can use a demonstration as a method of learning. When it comes to demonstration, we don't have much skill certification for anatomy in the CBME, but we can use the method of learning a skill for teaching this palpation and how with the effective and communication domains. That means you are going to keep in mind that how you are going to make or assess this part in the examination. Suppose you are planning an OSPE station. So there will be something like a checklist. So in the checklist, there will be certain steps to be followed. So you expect after the teaching session that the student will be able to perform like that in the examination. So keeping that in mind, you are planning your teaching learning method. So in that, suppose you are planning to do this as a demonstration. How are you going to do that? There is something called a Peyton's four-step approach. Now, the Peyton's four-step approach in skills training, they are demonstrate, deconstruction, comprehension, and execution. You can use this method if you want for learning that is the skills. Of course, skills means not only any psychomotor domain, the skill what you are telling, even communication is also a skill. There is communication skills, you say. So here, first one is demonstrate. Demonstrate the trainer. First step, what the trainer is going to do is they will go there, the trainees will be watching, the trainer will just do how it is to be done without giving any instructions. Second step will be now the trainer will again repeat the same procedure. At the same time, he or she will be telling what all, how you are going to go about this palpation. Okay, you are the human volunteer is sitting there. You make him feel comfortable. You show respect towards him. That comprises of the affective domain. You communicate with him. You just explain, okay, we are going to do these things. Okay, that is the communication, how to communicate. Then the steps of the skill, how you're going to do it. So that step by step, the trainer will tell, this is the step I'm performing like that, he will go. Then comes the third one, comprehension. Now, this is the most important one in this Peyton's four-step approach. This is what is happening is that the trainer is performing the skill, but he is not telling the procedure. He is asking the trainee. So he is doing the sub steps of the performance, how the trainee is describing to him. And then once the trainee knows that which are the steps and he is able to describe to the trainer the steps, that means he has learned. And the fourth step is execution. We can, if we want, we can use this method of demonstration for achieving certain skills. Of course, deriving teaching learning methods of ATCOM also I have just included here. That is to demonstrate, this is given in the ATCOM module, the competency is to demonstrate, respect and follow the correct procedure when handling cadavers and other biological tissues. So So here I have made some competencies again. That is the explain the procedures of procuring cadavers, enumerate the steps involved in the safe and clean handling and disposal of biological tissue, list the etiquettes to be followed in a dissection hall, which I have combined it as an interactive lecture so that I can finish in 1 hour lecture. First 2 hours in the beginning of the course, and next 2 hours it is supposed to be at the end of the course in ATCOM module. So once 1 hour I'm taking as a lecture, I'm explaining all these things. Then I'm bringing them down to the dissection hall, demonstrating. You have to demonstrate the respect to the cadaver, or in the lecture hall itself. Either you can do a role play and show, that is where the affective domain comes. Their role play or some videos how you demonstrate the respect to the cadaver, and you can involve the learner by involving them in taking a cadaveric oath. So these are the methods I'm using. When you go to the last one, with that is by the end of the course, what they are going, that is discuss the attitude and behavior exhibited by them in the dissection hall during 1 year of anatomy learning. That is a 2 hours session again. There also the affective domain, they have to think the knowledge, and they are trying the knows how they performed, how they did their how did they behave in the dissection hall during that 1 year. And that can be done like a reflective writing by the students itself, a feedback from the students. And also you can also, I think we can also give feedbacks that how, where they went right, where they went wrong. You can appreciate them as well as you can guide them for about their fallbacks, where are pitfalls were there. And you can also plan a cadaver Thanksgiving by the students by writing a poetry, or you are explaining or something very nice. You can make a mind mapping, the ideas of how you are going to give a Thanksgiving to the cadaver. So we always tell the students that cadaver is your first teacher in anatomy. So these are the methods which you can use in ATCOM teaching learning methods. Now, having said all these things, now I told you that the knowledge domain and skills domain about the low teacher student ratio, which we have to consider when we go to the higher level of proficiency. Now, the problem is that many a times how we are going to implement it in our settings, that is a big question mark. So we know there are so many methods. We all are very enthusiastic educators, especially I think anatomists, and we all want a low student teacher ratio to implement all these methods. But is it feasible? Is it feasible in your setting? That also you have to consider. So what is called as the criticality versus feasibility matrix? That is, there are two, this criticality feasibility matrix is there for knowledge domain as well as for the skills domain. So knowledge domain is more important for us. So what is this all about? Criticality acquisition, that means criticality means it is something, that is the competency belongs to a, what you call a core competency. It is a must. It is very important. Whereas feasibility, you know that whether it is feasible to do that or not. So there are 4 boxes here. I have named it as A, B, C, D. That is for the descriptive purpose. So the first box is showing that there are certain that is competencies or SLOs which we have designed, which is coming. It is under low criticality, non-core. It is non-core, not very important that it is a must know. Okay, at the same time, it is not feasible at your end also. In your settings, it is not feasible. So what you do is that you just give a large group instruction and finish it off. Next, going to the B, that is criticality is still low, that is it is non-core, but it is very highly feasible for you. There are so many patients, there are so many methods, and every infrastructure and trained teachers, everything is there. You can do it easily. Then just consider the risk and benefits of that. If the benefits are more, go for a small group method to teach that. No harm in doing that. Then when it comes to the box C, where it is highly important, it is very critical, that knowledge acquisition is very critical, high core competency, as well as it is highly feasible at your end. Okay, do it. use the small group settings and just to do it with a low student faculty ratio. No harm. Now, the problem lies in the box D, where there is high level of acquisition. We have to do it. It is very high, very important core, but it is not feasible at your end. So that is where you can consider a process of calling experts or the sub versus subject experts. You go in for a shared responsibility. Now, shared responsibility you are giving to the students. It is their responsibility. You are giving some emphasis on the self-directed learning. And you are innovating some technology and you are doing a large group case discussion or you are using a flipped classroom. So this I have done in my institution with the thyroid. Suppose there is you at that instant on that day or when that part of thyroid is coming, you don't have, some faculties have gone on leave or there is some crisis there. You have to do it with the short group or you have to instill that, and you don't have the infrastructure at that point of time, or there can be many other reasons also. Or if you want to do a role play, you don't have the faculties, you can show a video and you like that. So in that case, the best one of the method is the flipped classroom. It is actually this online method, today's method also I have done as an online method of a flipped classroom, where I have given you all the details of which all methods are there prior to this session so that I can discuss more on the deriving part of the teaching learning methods. Similarly, with the traditional method, what is happening is that the lower cognitive level, the remembering and understanding is happening in during the lecture class. Whereas when you go to a fifth class, what I did in thyroid, I will tell you that I gave all the materials of the normal anatomy of thyroid prior to the session, and in the dissection hall it was discussed along the normal anatomy was discussed in short group and the dissection it was shown. After that, in during the session of the learning process in that hour, what I did was that it was an application level of their knowledge into this clinical aspects. So it was a case based scenario. All my slides carried different case scenarios to explain the clinical aspects of each part of the thyroid gland, its applied anatomy. And so each slide was carrying a case scenario, and I divided the class into many groups of 10 each, and then it was a brainstorming session which was going inside that, which each slide and one group the representative would stand up and give the answers, and like that I would again emphasize on the important points, and it went on so smoothly that the students also appreciated well. They had a very good learning process during that time. So you can opt for such methods. It was a large group. At the same time, it was very effective also. So similarly, in the skills domain also, if it is low feasibility and low criticality, just an awareness of a skill is sufficient. Like that, if it is very highly feasible, you can just ask him, you can observe or assist, even though it is critically low. And again, in the section C, it is highly feasible and highly critical. Okay, go for the certification and performance by the student. And if it is, again, there is low feasibility but high criticality, okay, you don't have a skills lab, it has not been done into, you can share with some institution, consider collaborating with other institutions, and you can implement it. So this is how you go about in deriving the teaching learning methods. So now, after considering all this, I would just tell you that during your assignments where you are going to divide into groups, the first step is in the deriving an objective and choosing a teaching learning method. Here, what you can do is that from the competencies which has been given to you, you can make it into sub-competencies, name the topic. After you have, it is a competency or sub-competency, identify the learning objectives, write down who are the target audience. Okay, it is phase 1 MBBS students. How many students are there? Then you choose 3 or 4 methods you want: lecture, small group discussion, DOAP, whatever. Write down the advantages and disadvantages, the infrastructure, faculty preparation required for all these things. Okay, fine, you have done with that. Then you compare which is the more advantageous, and in your infrastructure, in your setting, which is feasible. And then you make a summary sheet, in that is the name of the lesson, number of learners, which are what all objectives are there, and which is going to be the primary method of the teaching learning process. So that method you have chosen, write down its advantages and disadvantages, the faculty preparation, how much time you need for that, and then break up step 1, step 2, that is a lesson plan. And then you write down what all teaching learning aids you need, the infrastructure required, and the student preparation. And if you are doing an instant assessment like a pre-test or a post-test, whatever, you can write it down. That makes a sheet, summary sheet. So now you know, for this topic or this session, I have chosen this teaching learning method and these are the requirements. So this is how you have to plan it out. And of course, I would like to say, with the impact of the COVID-19, we all agree that our lives have gone a 360-degree turn, where education has gone haywire, and only means of holding to it now is the e-learning methods. So what comes into my mind is, during the assignment sessions, we can also plan, or we can also include some best e-learning methods also for the SLOs which we have created. And having said this, I personally feel that e-learning in medical education should be considered only for blended learning, or else it might get ended up like this. Let it not be so. That is, you have your X-ray shows a broken rib, and we have fixed it with a Photoshop. So let that not happen. Okay, so I'm coming or summarizing by telling that CBME is a student-centric curriculum. Teacher's role is that of a facilitator. Teaching learning methods should be learner-oriented. 1/3 lectures, 2/3 of all these interactive small groups and self-directed learning. And teaching learning methods are selected based on the domain and level of the objectives, and it is assessment driven. Teaching learning sessions should be created by grouping together the teaching objectives, and the choosing the teaching learning method at your end or in your settings can be done by considering the criticality versus feasibility matrix. So those are the main important things which we have to consider. And I would conclude by saying that competency-based learning places an emphasis on powerful or rich learning environment, and it enables the teacher and student to engage in a very meaningful learning process. So I would say that let us join hands to involve, internalize, improvise, and innovate in this learning process. Thank you. Any questions or any discussions, we can go for that.
Yeah, please raise hands if any questions for ma'am. Yeah, ma'am, Dr. Kanan Shah.
Yeah, please.
Please unmute yourself. Please unmute yourself, Mr. Kanan Shah. Dr. Kanan Shah, please unmute yourself. You're self-muted. Please ask your question. Ma'am, I think he's unable to do that. Yeah.
Okay.
Dr. Gayatri Murugabu. Please unmute yourself, ma'am.
Yes, please, Dr. Gayatri.
Dr. Gayatri, please unmute yourself. You're self-muted. Please unmute yourself, Dr. Gayatri. Yeah. Please ask question.
Yes, madam. So am I audible?
Yes, please.
Yes, good evening, madam. So it
Good
was a
evening.
nice presentation.
Thank you.
So I had a doubt in that criticality of acquisition. So
Yes,
can you
please.
explain that once again, ma'am?
Okay, sure. I will explain that once again. I will go consider the knowledge domain because that is more important for us. What I'm trying to tell is that there is a competency from non-core. Non-core means it is nice to know. I mean, it is okay, good if the student knows that. It is not a must-know category. That means the criticality is less or low criticality. At the same time, feasibility is at your end, in your college, in your setting, whether thus if you choose that, that is, I'm talking this when you consider a low teacher student ratio. That means you have to make small group discussions. So in that setting, suppose that is you don't have the infrastructure, it is not feasible at your end. So with that, when it is okay, it is not much important also that it is not a must know category, you say that the criticality is less. At the same time, the feasibility is also low. So that means it might be a non-core topic, which is not very much important. So I'm just telling one example, like you take, okay, ossification of flat bones or the ossification, age of ossification, all these things. So if you don't want, it is not very important if you consider. At the same time, you can't afford to have a small group discussion for all those things. You just mention it in a large group discussion, or that in that way you can finish it off. But the problem arises when it is highly feasible, it is okay for us. Highly feasible means it is okay in our setting, in our college, in our department. We can easily conduct that teaching learning method in a low student teacher ratio. That means small groups. You can easily do it with more learner involvement. So when it is highly feasible, it is not at all a problem, whether it is core or non-core. Problem arises when it is highly important, at the same time it is not much feasible for you in your setting to make a low teacher student ratio, make so many groups and involve the students and have them. In that case, you can effectively do that by giving some emphasis on self-directed learning process. That is, I told you, it is a guided self-directed learning, that is teacher guided. You are giving them the materials, you are trying to give them the knowledge, ask them to learn and come. And in a large group lecture class itself, you can go in for a buzz session or a brainstorming session, dividing the whole large group into small groups within the lecture class itself, and you are giving some case-based learning. That is why I told you in the beginning that you can combine so many methods together. So if you do that, so it is not feasible. You don't have your faculties on that day to conduct so many small group discussions. Your single person is handling that, but it is in an effective way you are doing it. So that the small group discussion, the involvement of the students are coming into it, but at the same time, you are doing it for a large group also. So that is what I'm telling, that from it varies from college to college. So there will be the settings are different in each college. So you can consider what are the settings in your college and you can decide on that. Is it clear? Am I clear? Hello?
It was clear.
Hello?
Yes, ma'am. Am I audible?
Ah, yes. Is that clear
Yes, ma'am. Yes, ma'am. Yes, ma'am. Now it is clear. Thank you, madam.
now? Okay, thank you. Any more questions or discussions? Hello? Any more questions, please? Am I audible? Hello, am I audible? Are there any questions? Any more discussions? I can't hear anyone, that's why I'm asking. Am I audible?
Okay, ma'am.
No more questions? Hope everything was clear.
Hello, ma'am.
Yes, please.
Ma'am, Dr.
Yes.
Amit Srivastava, I want one. Hello.
Yes, please, doctor. Good evening.
Hello.
During the learning objective and domain discussion, draw a label diagram, then it is written knowledge base. I think it should be better if it's skill based. You're drawing.
That is what I would like to clear, that is that how are we going to assess them for that drawing? We are just looking whether during the theory paper they are going to draw a diagram for when they are answering a question. We are not assessing their skill of drawing. So when they draw it, it is their knowledge what they are putting into the paper. That is how they are going to draw that, and what are the relations, how it is put there. So that is the knowledge what is put into the paper. When you are assessing a skill, means the skill is how they are doing a thing. That is a skill, a process. As you are going to assess, that is the steps of some procedure. That is a skill that you. Here we are not assessing their skills in their drawing. So what I understand, it is their knowledge domain.
Okay. Yes, I have some doubt because it is a very small difference between these two activities. That is why I asked.
Yes, yeah, I know. There are more, even some areas where it is given as shows how also in the book also, there is some
Yeah.
areas where discussion is needed.
Okay. Thank you.
Thank you.
Dr. Deepti Shastri, please unmute yourself. You can ask your question.
Thank you. Dr. Sheila, that was a very good presentation. It was very
Thank you.
clear how to actually align the teaching learning methods to different domains of learning. I just wanted to know whether you can share how you have taught attitude to first MBBS students, maybe in the dissection hall or in the theory class and so on.
Attitude, when you talk, what we were telling even in the foundation course was that the learning of attitude should begin from the first day onwards. Even the behavior towards their peers, how they behave towards their teachers, all these are accountable towards their attitude learning, is what I understand. And even how they behave to all the faculties there in the department, how they behave with the students, how they should be doing about. So all these are what I understand is what we can teach. And even their what you call the professionalism which comes into all these things are depending on their attitude. That is how they behave in the class, how they behave, they come on time for the class. All these we have stressed on with the attitude or the effective domain is my understanding. I don't know whether I'm correct or not.
Thank you, Dr. Sheila. I agree with you. I just wanted to know if any participants also can share if all the things that you just said, whether it is punctuality or understanding their responsibility and completing their records in time, or doing their assignments in time. All these can be taken as professional attributes. I
Yeah.
just want to know from other resource persons or participants whether any of you has graded them based on their attitude, or grading has been done only for theory and practicals and viva so far, and the professional aspect or attitude aspect has not been graded at all.
Actually, in our university, they have given a pattern of doing the formative assessment for that part. That is considering their attendance and how perfect they are in, submitting their assignments, how they are behave in the class. That is how they are enthusiastic in presenting in a small group discussions. All these can be considered. That's what our university has given us a guidelines also. I don't know about others. Others, please share your opinions. Even I would also like to know.
Your university doing that, it's a good thing, actually.
Madam, good evening, ma'am. This is Dr. Dimpi Gupta. May I have a word?
Yeah, sure, please.
Yes, ma'am. Very nice presentation. Very well explained.
Thank
I
you.
just wanted to reply on the similar topic. I had a question pertaining the same, that how to manage the attitude of the students, because I am right now in Parul Institute of Medical Sciences, Vadodara. Uh, right now in our institute, we are not assessing student according to the attitude, but I was the university in which I was previously, there we used to manage a logbook for the dissection, where we used to assess child on how much he or she participates during any practical assignment, or what is the attitude, what is the level of the child to acquire a skill, and all the parameters which are related to the attitude of the child or the student, sorry, to learn a skill, how attentive he or she is, all those multiple factors. And
Okay.
that proved out to be a very good method, which forced students basically, or because of which students were became more attentive towards their attitude. Right now we are not doing that, which is lacking. And
Okay.
also I had one more question. May I
Yeah.
continue? May I continue with the
Yeah,
question?
please. Yeah.
Yes. uh, Regarding the same thing, criticality versus feasibility, uh,
Yeah.
I want to share the problem
Yeah.
which we are facing in our university. So right now we are six of the staff, seven of the staff members, but one of them is dean. So teaching is not being performed by him. See, these are all practical things, ma'am,
Yeah.
uh,
Fine.
which every private institution at least is facing. Then
Yes.
after him, we are left with only six teaching staff effectively. And from this academic year 2019, there were 150 students in MBBS batch,
Hmm.
and amongst those six, we were only four of us were there who were handling 150 students for practical basis.
Okay.
Initially, before that, we had only three. So
Hmm.
only assistant professors and tutors were taking practicals. So practically, we each teacher had 50 students for dissections and demonstrations. So now,
Hmm.
if I take the same example of which you took, like palpation of brachial artery, I'm just taking that example.
Yeah.
And according to us, it is a very important thing.
Hmm.
I think it is must to know.
Yes.
So in that step, till now we were teaching students how to palpate brachial artery in a
Hmm.
small group. If I am taking demonstration of 50 students at a time, I am telling them, and I even asked them. I had done
Yes.
that
Hmm.
palpate it. Or
Hmm.
I have also asked them to palpate your friend's brachial artery in the similar manner in which I am doing.
Hmm.
But it is not, I thought it was not feasible to ask them singly, each and every student, to perform, demonstrate, and explain whatever he or she is doing. So how to manage that problem? the way you asked that, the way you told was absolutely correct. That we need to be sure whether the student has understood the procedure, and he or she should develop the skill of understanding
Yeah,
and
I
also
understand. I
demonstrate.
understand. Yeah. So
But it
there,
is not
what I
feasible for us to ask 50 students one by one to demonstrate brachial artery pulsation.
Yes, I understand. So if it is
How
not
to do that?
feasible, yeah, if it
Huh.
is not feasible, my take on this is that you can use videos to show the demonstration steps, very clear videos. And
Hmm.
like you can use, that is what, e-learning as a blended learning, or an LMS, if you can use a Google Classroom or a Moodle platform. In that you can tell that I have put this video, you can all of you can go and learn the steps and come. And I have mentioned in my previous PPT, which I had given you to read, there is a method of
Uh,
peer learning or peer teaching, that you
yes,
can
ma'am. Yes,
even
ma'am.
ask, you can train one student and you can ask that student to train others and find out whether they all are doing it is correctly. That is one method what comes into my mind when there are such difficulties.
Okay, ma'am. And one more thing. I want to know what all methods for surface marking teaching are being acquired by medical staff all over India. I don't know, because we are only performing surface marking teaching on a cadaver.
Yes.
But according to me,
Hmm.
not sorry, not on cadaver. In fact, on a mummy. So when
Uh-huh.
we do it on a mummy, then
Hmm.
all the parameters totally change, and it is not feasible to ask a student to like draw the same surface marking on a living person, because the parameters will change. A mummified body is totally different than a living body. It is totally different than a cadaveric body.
Hmm.
So
We do it on a
what should be
cadaver.
the
Hmm.
appropriate method of teaching surface marking? And again, when we teach, for example, a teacher is teaching 50 students at a time, we cannot ask each and every student to demonstrate then and there. For example, surface marking of lung and heart are very important. So how can we ask the student to demonstrate surface marking? And I think personally that teaching on a mummy is totally wrong, because the
Ah,
student cannot get an impression, because the abdomen is so shrunken that the whole abdomen and thorax is covered and by only thorax.
of course, doctor.
This I
If you
felt
feel that,
personally.
if you feel now that is your feedback which you have got, that teaching surface marking on a mummified body is not correct, you change it. That is what I said you. The feedback is very important. You can change your teaching learning method, and you can use a cadaver, or if on whichever feasible method on a living body also you can adopt into that, as well as uh, that is what I told. Here in this CBME, what is most important is that this is a collaborative learning. The learner has to be involved in his learning process. So it is not only the responsibility of the teacher, it is not only our responsibility that we have to look whether he or she has learned it. It is their responsibility to learn. Even if it is the logbook, what I say, I have told all my faculties in my department, it is the
Hmm.
responsibility of the student to get it signed, because they have to call us at a whichever time it is feasible and make sure that he has learned it. So we can't go, and
Hmm.
what I feel is we can't go individually behind all these 150 or 200, even 250 are there in some
Hmm. Hmm.
colleges. And we know
Hmm.
that how much faculty strength MCI is telling us in anatomy. So it
Hmm.
is the actually the responsibility of the learner. So you don't
Uh,
bother about that so much, because it is their botheration too, is what my understanding. It is a learning, collaborative learning. So it is their duty. They can ask, they can consult with their peers, they can learn between themselves, and then in a feasible date or time, they can come and approach us and say, okay, ma'am, can you just check whether what I'm doing is correct or not?
okay, ma'am. Okay, ma'am. Hmm.
Okay, thank you.
Yes, actually, we also feel that it is students' responsibility. If a student doesn't want to learn, then we can't do anything.
Yeah, we can't do. Actually, the
We
problem
can't
here
run
in
after
CBME,
every
the problem in actually,
method.
if it's a pure CBME curriculum, it is not time based. Here, what we have implemented is a hybrid method. So there is a little bit of problem with that also. Within the time we are finishing this. So if it is a Pakka CBME, it is actually
Okay.
not time based. That is, we will assess and we will certify only when he will go to the next level, only if he has attained that competence. That is the actual essence of CBME.
Okay, ma'am. Also, one more thing which ma'am previously madam asked. I wanted to tell that we also have acquired a method where in first internal assessment or a periodical assessment exam, after doing a periodical assessment exam, we tried to regroup the students according to their marks, and then we divided the students, and then we tried to take sessions according to the students level of understanding. So can it be incorporated as a part of a curriculum?
See, the CBME, what is I told you the main thing in the CBME principles is that formative assessment is more important than summative assessment. So you want to try it as in a formative assessment, you can try any methods there and you can include
Okay,
that in your formative assessment. No harm in doing that.
okay, ma'am. Okay, ma'am. Thank you so much, ma'am.
I asked the organizer to please unmute Dr. Shilpa, Dr. Swati Purnima, Dr. Debasis. They have all
Yes,
raised their hands.
yes,
Please
ma'am.
unmute each one of them. Thank you.
Yeah, ma'am. Dr. Shilpa is unmuted.
Yeah, hello, ma'am, and
Hello.
congratulations and thank you for such a beautiful presentation, ma'am. No scopes for any doubts left. But
Thank you
you know,
so much.
personally, ma'am, what I feel is there's a lot of time crunch,
Yeah.
and as you already said that pure CBME is not, but still, if we are hybridizing, like for example, do we really have time for self-directed learning in a lecture where we are rushing to go through everything?
It's self-directed learning. There are certain hours in which we can give, and so many things. I think what we can do is that they can learn from on their own at their pace. If you want, you can. That is what I told you. If there is an LMS, you can share that. They let them learn at their pace. So that depends for the students' enthusiasm to learn also. It
Okay,
is their
and
learning process.
anything we can do for time management with respect to CBME? This is what we are facing right now. That either it is a mad rush or it is too much of a. Where do we strike a balance?
Regarding time, I can't say now. Whatever has we have got, we have to follow. But what I said is that is so much we can guide them under a guided self-directed methods. We can go. We can give them the materials what they are supposed to learn, and we have to formulate a timetable which is shooting. I think by the end of this whole course, we are going to formulate a timetable for this whole anatomy.
And ma'am,
So
one more thing,
probably we
like
will
we
take
went for the
all the
thyroid.
feedback.
Yes, ma'am.
We'll have a good discussion and we can frame a good timetable by the end of this course.
Yeah, ma'am, I think I asked this previously also. Like you took that example of thyroid. We have more further, beautifully you told us, okay, what can be integrated in a lecture, what can go as a demonstration. But still, I ask you one thing more.
Yes.
Previously also we went the same way when we had the old curriculum. We taught them everything with this. So you know what, personally, it is just my personal opinion that I find the CBME is a more sophisticated and fancy way of doing the same things. I don't find anything new, which I don't know, is it my personal confusion or
Might be there are, I told you it is a hybrid curriculum. There are so many things which we are doing, which we did previously also. But only thing is that here we can implement newer methods of learning and we can make it a little bit more interactive and we can make it into small group discussions. And one take on this is that even I personally feel that even before in our curriculum, we used to take only so many lecture classes. We were more concentrating on the dissection hours and we had more of small group teaching methods is what I feel. So here what we can do is better. You have to we have to see the outcome of the student, and we are concentrating on whether the student is able to achieve the competency. Then that is
Yes.
where the formative assessment is more important. So with
Yes,
considering that fact, we can go forwards with the teaching learning methods.
Yes, ma'am. That brings me to the last question. You actually yourself drove me to that. When we say outcome-based thing, yeah, this was, what was in my mind. If we actually, how do we gauge the outcome of this new CBME? What will be the parameters for that?
See, actually,
Now,
CBME should not be compartmentalized into anatomy, physiology separately. It is not a compartmentalization. What we expect is at the end of the MBBS course, what an IMG should be, an Indian medical graduate, as a clinician, as a professional. That is actually the outcome, is what I understand. It is
and ma'am,
not
one more
only
thing.
the outcome. For
Exactly,
that to
ma'am.
happen,
What I thought was, what I have been seeing, overseas, is that they integrate anatomy, physiology, pathology, pharmacology, medicine,
I know.
surgery of entirely of one thyroid of one. So why didn't it happen for us in India? I feel it. We are at square one. This is what we were doing before. This is
I'm
one
sorry.
thing.
And this is actually, see, that is system-based learning, what is happening there.
Exactly.
Here,
Yeah.
our anatomy module, which has been given, is of course not system-based. It is region-wise. So we have to go region-wise only. And we believe that doing a dissection and will be easier for us, for anatomists, region-wise, not system-wise. System-wise, we feel that it will be more complicated for a dissection to happen.
Okay, ma'am. So in India, it is not happening any soon.
I don't know. Let us implement this first, and then we'll gradually progress.
Thank you so much, ma'am. And thank you for such a beautiful presentation, ma'am.
Thank you.
Dr. Sheila, Dr. Girija wants to share the screen. She cannot be unmuted, but she wants, I request the organizer also, once Dr. Sheila finishes her presentation, please unmute Dr. Girija, because she has to share her screen to divide the batch into groups. Thank you.
Yes. Ma'am, I've made Dr. Girja the presenter.
Yes.
She's unmuted, ma'am.
Yeah. Thank you, ma'am. Ma'am, we'll wait for some more questions, ma'am.
Yes, Dr. Girija, I think we should wait for some more questions.
Yes, ma'am.
Dr. Swati Purnima and Dr. Debasis want to ask questions.
Ma'am, Dr. Swati is already unmuted, ma'am.
Okay, ma'am. Can I speak now? Dr. Swati here.
Yeah, please, Dr. Swati.
Good evening, ma'am.
Good evening.
Very nice presentation, ma'am. You have cleared many of my doubts, ma'am. A small doubt from my side, ma'am, regarding creating capacity in the block D, madam, like the feasibility and criticality foursquare. Like the block D, low feasibility with high criticality. The first one was create capacity. Like here we have used process experts versus subject experts, ma'am. I just wanted a clarity. Who are these process experts and subject experts? Okay, that is our expert. Who will come under this process experts, madam?
The process expert, what my understanding as for the criticality feasibility ratio, the structure is that, isn't it? That is
the block D, madam. The yes.
Just a minute. Let me look into that. That is create. Actually, I think I'm not very clear. I'm not very clear about it. If somebody else can help me, please help me out. I think the process expert versus subject expert creating a capacity is what I feel is that this whole process of the CBME, or where I think what I believe is that the MEU, the other
stakeholders, ma'am.
Yeah, stakeholders, they can all come into the this one. I think what I feel is that we can even take help from other departments where they can help
like
us
the
out.
integration part of it, madam, the
Integration
vertical and the
part we can help. Yeah.
Okay. Like the members, like the medical education unit members, and the ones who are involved into this integration part.
I think that is my understanding. I don't know if I'm wrong. Others please interfere and correct me also.
Yes, ma'am. Thank you. I had this doubt, madam. Even I had the same consensus of process experts to be somebody from the clinical side in vertical and India. So I just wanted to clear this doubt right from my SIP programs, madam. So I just wanted to find it out. Okay. Thank you, ma'am. Thank you, ma'am. Thank you.
Dr. Sheila, can you hear me?
Hello. Hello. I can't hear you.
This is Angela.
Okay.
That was an awesome presentation. I just wanted to clarify something which the madam previously had asked. So she was asking what is the difference here between competency-based curriculum and the traditional curriculum.
Yeah.
Competency, we want an observable ability of a health professional that can be integrating multiple components. So this is the observable change which we want. Right now, what I think is happening is we have not changed much. We are conforming. We are the purists who remain with the old curriculum. So it is this program, this workshop should actually bring about a change in us, wherein which we can break down this competency into specific learning objectives. And once we identify the domains correctly, as you rightly said, madam, we will be able to use newer techniques rather than conform to the old form of lecture. So she was saying that it's a mad rush of time to complete all the objectives in one session. We don't want to do it in one session. As you said, we could put it into different sessions. So relations, we are not discussing it along with the lecture. You've rightly said that we could use a small group discussion or a flipped classroom. So once we divide our lecture into various parts, it becomes easy for us to, we don't have to rush through the topic. So the crux of this is breaking it down into the right objectives, identifying the right domains, and then aligning it. So this, I think, would solve a lot of our issues. And if as we go into this course we do this correctly, it will become much more easier for all of us. So I just wanted to add that point when madam was saying about the mad rush of time which we are facing.
Thank you, Dr. Angela.
It's mostly because we are not ready for the change.
Exactly.
Dr. Jaswinder Kaur, please unmute yourself and you can ask your question.
Hello, ma'am. Good evening.
Good evening.
Ma'am, I want to ask about the histology part. We have to pay more attention towards the theory part or towards the practical part. I think the students are unable to draw the right diagram of the histology part. So what we can do to improve the histology part of the students? I think in my institution, the students are unable to identify the slides or draw the correct diagrams of the slides. And how we can improve it?
That is what is meant by we are going to look into the logbook is what my understanding is that is they are going to draw the diagram correctly. Until they don't draw it correctly, they don't understand, they don't do it correctly, don't give don't certify that they are competent for that. So it is their problem that they have to learn to draw, they have to take their efforts, they can come and discuss with the teachers, and they can find out where they went wrong. You can give feedbacks. Of course, I told you feedback is a method of teaching learning process. So you
yes,
can
ma'am.
give them feedback, give them feedback. If in the logbook also, I think we have got discussion on the logbook, how to go about it. So which we
Okay,
have to
ma'am.
find out, we will find out which all are the competencies we are going to put in the logbook. Of course, all the practicals, we have to put it in the logbook. So until they do
Okay,
it
ma'am.
correctly, you are not going to certify it.
And what about the ma'am lectures
Lectures
on
regarding
histology classes?
histology classes, again, you can have an
I'll,
or if you want, you
yes,
can
ma'am.
make it a small group discussion where
Okay,
you
ma'am.
can
Small
enhance
group
the
discussion.
learning, where you small group discussion in the during the lab you are explaining this, and after that they are going and seeing the slides, and
Okay, ma'am.
there also you can give individual attention of showing the students of how they are seeing the slide and how what is the method of identifying which are the salient features they have to look into. And in our institution, I have divided the students for each faculty. I have got,
Okay,
and
ma'am.
that remains the same. And those faculties, they never give the signature until this one is correct, the diagram is correct.
Okay,
They give
ma'am.
redraw, redraw, redraw.
Okay, ma'am. Okay. Okay,
Okay.
ma'am. Thank you.
Ma'am, can I interrupt here once?
Yeah, sure.
Yeah, ma'am, as she, madam just asked, how many times, ma'am, will we go on certifying if they don't get it right? And where will the chain end?
There is, I think, in the logbook we will. There are categories under which you are going to do. That is, we will ask them to repeat, and again, whether they did it in the first time or whether it was the second time in the second this one attempt they did, or it was after again again they are going and learning and coming back like that. There are categories under which you are going to certify them. But I really don't know how far we can wait, because there are some students who are
Which never
really
give
bad.
any attempt.
Yeah, at the
So
end,
what
I
is the
mean,
solution for them, ma'am?
Sheila
what we
ma'am,
can do.
can I
Yeah,
give a
please.
suggestion here?
Yeah.
When I was a student, I myself found it very difficult to draw histology diagrams and identify slides under the microscope. So I can understand the mediocre student who has difficulty in understanding the subject. In what way our students could follow histology a little better is what you have suggested earlier, using technology. If we focus the slide on CCTV, the student can see it better along with their friends. Other than looking into the microscope by themselves and identifying, if you project it with a trinocular microscope on a CCTV and you
Yes,
point out
exactly.
each cell connective tissue, they can understand it better. Also, diagrams. If you have easier diagrams that another student has drawn, which is perfect, or one of the faculty who draws very well, and you project it on a screen where all the students can see it, and then you ask them to draw. It is an easier method of them drawing. Otherwise, they'll draw 10, 15 times, and the faculty may be exhausted correcting their records. So if you really want them to learn, instead of asking them to imagine how the picture is from the microscope and draw themselves, now we have so many textbooks which give illustrative diagrams of those structures. You can project them on the screen. It becomes easier for them to learn. And you just need one teacher to monitor the CCTV and projection of the diagrams. Thank you.
Actually, we are doing that, ma'am, in our college. We have a lecture session with, that is so many objectives you combine to form a one session might be the objectives SLOs for histology for different structures like thyroid, parathyroid, pituitary. I'm taking all these. I combine that as a session of a lecture session. After the lecture session, when they come for the practicals, we again have this projection of the microscope onto a TV screen or this onto that LCD projector, and we explain that. And actually our faculties, they draw the diagram at that time or on the board also, as well as we keep a record there, which there is a beautiful diagram which has already been drawn, and we ask the students to refer all these things, and then we ask them to draw a little small part of that whatever slide in the class itself. And I ask, there are concerned faculties, and we tell them, go and show it the part wise with what they have drawn. If it is correct, they can complete the diagram. So it will be a very easy process that they did not keep on going for redraw.
I'm just
should I?
requesting organizer, can you unmute anybody else?
Yeah, yes, ma'am. Dr. Sarla. Yeah. Dr. Sarla, please ask your question. You are unmuted, Dr. Sarla. I think she's not there, ma'am. Dr. Debasis Bandhupat. Dr. Debasis, please unmute yourself and ask your question. Dr. Debasis. I think, ma'am, nobody is asking. There are just 2 to 3 hands left and they are not unmuting themselves. Hello? Am I audible, ma'am?
Yeah.
Ma'am, I think we are done almost.
Okay, okay. So shall we go for the other activity by Dr. Girija?
Yes, ma'am.
I will mute mine. Yeah.
Dr. Girija, please unmute yourself.
Am I audible, ma'am?
Yes, ma'am, you are audible.
Yeah, fine. Dear participants, after listening to such a wonderful session on teaching learning methods, how to frame your teaching learning method based on the domain, Dr. Sheila has delivered such a beautiful lecture today. Hope it is very well understood by all the participants. Following that, after the sessions on SLOs and teaching learning methods, here we have the grouping of the participants. And this is what we are going to follow for the next 4 months. And this schedule we have already shared in the group. Those who have not noticed, here once again we are projecting it. The program will go until November, and here is the date wise schedule, and the dates may change depending upon any festival or any other emergency condition. Overall, we have 326 participants, and we have divided these participants into different groups. Each group will have one resource person, and each resource person will be providing you all the materials, all the activities to be done by the groups. And then they will assign you all the work, what you have to do. And out in the group, the participants, you have to assign one as a moderator and one as a record keeper. Our main objective of this workshop is to develop a booklet which gives out a clear picture of about at least about to 99% of convincing the MCI booklet. We are going to develop all the competencies, SLOs, the teaching learning methods and the assessment methods, everything. Where to design the SDL, where to go with integration, and where to go with the alignment and all. That is what we are going to do in the next 4 months. And this is just an example of what is given in the MCI booklet. One competency, and which under which domain it is coming, and what level of competency it is, and whether it is a core or a non-core. What is the teaching learning method you are going to choose, and what is the assessment method you are going to do, and whether it needs an integration or the alignment. This is what we are going to do for each competency. These competencies will be allotted to the groups by the resource person. Any clarifications, any doubts, you can just approach with your resource person. And this is how for each resource person there will be 2 groups, and each group will contain close to 15 or 16 or 14 participants depending upon the division. And each group will have this number of participants, and within the group itself there will be some small subgroups who will be given with the competencies. The competencies are classified based on the region and what is given in the booklet, and those competencies will be allotted by your resource person. Just this is an overview. Further, any queries or the clarifications or the doubts, you can contact with your resource person. All the resource person are there in the Google Classroom. Dr. Bedi has created a Google Classroom where we all 400 people are there in that classroom. Earlier, it was a limited classroom where more than 250 members were not being able to be added. Now, sir has created a new classroom where 1,000 people can be added at a maximum. So now we are all into one group. Whatever you want to ask or put a query, you can just do it in the classroom. All the activities you have to post it in the Google Classroom. At the end of this program, we will be compiling the activities of all the groups. We will make it into a complete booklet. And these activities, templates will be provided by your resource person, and the moderator see to it the same template is being followed for all the competencies. So any queries you can post in the WhatsApp group. We are here to respond to you. Thank you. Thank you, ma'am.
Thank you, Dr. Girija, and thank you, Dr. Sheila. Ma'am, should I end the webinar?
Yes, ma'am. I think we can close the webinar. If they have any questions, they will post it in the WhatsApp group, ma'am.
Right, ma'am. Thank you, ma'am. Thanks a lot. Thanks, everyone.